They are the heroes in the fight against coronavirus, and with cases surging across the Houston area, they are the ones you want on the front lines.
Tonight, some of our doctors and nurses share their experiences exclusively with Channel 2 investigator Bill Spencer. They hope it inspires you to help them get this pandemic under control.
Dr. Gildardo Ceballos, a 20-year internal medicine doc, suits up to begin what will be yet another long, agonizing day in the war against COVID-19.
I feel powerless because the patients, die despite all the medical treatment.
We're gonna make a coffee.
To date, Dr. Ceballos has watched 15 of his COVID patients die since the middle of March. The most crushing, 3 members of the very same family, mother, father, and their adult son.
It destroyed my heart, it's really hard talking to the rest of the family every day, 2-3 times a day. And they were hoping, hearing good news, but it's hard for me, to telling them that they were dying. It's horrible.
Dr. Ceballos is not alone.
They're so sick that if they don't get put on, they don't get that support, they're probably going to die. I had 3 beds.
And this is my new normal for the next however many months that it takes for this virus to die down.
All over the country, exhausted medical workers are giving everything they have to keep fighting this pandemic. Dr. Rochelle Williams, for one.
Seeing patients that can't come off the vent, the pneumonia has affected both their lungs, the feeling that they can't breathe, having to be intubated, being in the hospital for months and never leaving until you're in a body bag.
In Richmond, Anthony Lundquist is a nurse and ICU clinical coordinator at Oak Bend Medical Center. They are currently treating 50 patients with COVID-19.
I was talking to a patient that was my age. I'm 30. And I was talking to him, telling him that we were going to get him over this. He was so young, we were talking like friends almost. And then he ended up passing away that evening.
Yes, there is plenty of pain at work, but Anthony's greatest fear is...
I have Phoenix, who is 4 years old, and I have Adeline, who is 2 years old. And my biggest concern is that I will take this home to them.
In Conroe, nurse practitioner Holly Benson is so dedicated to saving lives and killing this virus. She left her loving family for 6 weeks and traveled all the way to New York to a hospital that was overrun with COVID patients.
I think some of the most heartbreaking moments was in those moments when family actually was allowed in. They had to gear up, only got a few minutes with the patient, but to visit, to possibly be saying their goodbyes. And those were the most heartbreaking moments. There wouldn't be a dry eye in the room.
Holly says what startles her the most about this disease is how vicious it can be, how fast it kills.
I've seen the worst of the worst, and it's horrible. I left in tears many days from the hospital in New York because of what it can do to people.
This, to me, as a healthcare worker, is so scary. This is something we've never encountered before.
And in Sugar Land, Jen Gillen is a registered nurse working in the med-surg unit at Methodist Hospital, where they have 100 COVID cases. She says the very toughest part of this war is feeling like she's fighting it all alone, without those of us in the public taking the precautions we should.
It's almost like a double shot to the heart because I've just struggled through the day, giving everything I have, and then we come home and we're met with people who don't want to help us. They don't want to continue fighting this virus like we are.
All those medical professionals say they are doing everything they can to protect us. They say the best thing we could do for them is stop the spread. Wear a mask, wash your hands, social distance. I'm Bill Spencer, KPRC, Channel 2 Investigates.